Hello, everyone. Welcome to episode 2 of the California CNA Test Preparation podcast. Are you ready to begin?
Okay, let's go.
Part 1. Today we will study 10 medical vocabulary terms from our medical vocabulary list with definitions and context.
Agnosia.
The failure to recognize or identify objects despite intact sensory function.
Context.
Due to brain injury, the patient developed agnosia and could no longer recognize familiar objects like keys or glasses. Airborne precautions. Transmission-based precautions used for clients with diagnosed or suspected pathogens spread by very small airborne particles from nasal and oral secretions that can float long distances through the air, such as measles and tuberculosis. Context. The hospital implemented airborne precautions for the patient with suspected tuberculosis, requiring all staff to wear N95 respirators.
Ambulation.
A medical term used for walking. Context. The patient's ambulation improved significantly after hip replacement surgery and physical therapy.
Angina.
Sudden chest pain beneath the sternum, breastbone, associated with a heart attack, myocardial infarction, often radiating down the left arm in male patients. Context. The patient described experiencing angina during physical activity, prompting the cardiologist to order further cardiac testing.
Anxiety disorder.
A condition diagnosed when an individual experiences more than temporary worry or fear that interferes with their daily functioning. Context. The patient was referred to a mental health specialist after being diagnosed with an anxiety disorder that was affecting their ability to work.
Anxiety.
A universal human experience that includes feelings of apprehension, uneasiness, uncertainty, or dread resulting from a real or perceived threat. Context. The patient expressed anxiety about the upcoming surgery, so the nurse provided detailed information about the procedure to help reduce their fears.
Aphasia.
A condition with difficulty processing what one is hearing or responding to questions due to dementia, brain injuries, or strokes. Context. Following his stroke, the patient developed aphasia and required speech therapy to regain communication abilities.
Apraxia.
The impaired ability to carry out motor activities despite intact motor function. This means the person can understand instructions and has the ability to complete an action but cannot process the cue to perform the task. Context. The occupational therapist worked with a patient who had apraxia to break down daily tasks into simple, manageable steps.
Aspiration.
Inadvertently breathing fluid or food into the airway instead of swallowing it. Context. The speech therapist evaluated the patient's swallowing ability to prevent aspiration pneumonia during meals.
Assisted devices.
Devices such as gait belts and walkers that are used when moving a patient. Context. The physical therapist recommended assistive devices like a walker to help the patient maintain independence while ensuring safety. Part 2. CNA Skill 2. Now let's focus on CNA Skill 2. What is CNA Skill 2? CNA Skill 02. Skill 2. Applies one knee-high compression stocking, Ted hose. 1. Introduce yourself and explain the procedure to the patient. 2. Provide privacy. 3. Perform hand hygiene. Position the patient in the supine position. Expose only the leg the candidate will be placing the stocking on. 5. Gather supplies and turn the stocking inside out to the heel. 6. Place the stocking over the patient's toes, foot, and heel. 7. Gently pull the stocking up their leg. 8. Moves foot and leg gently and naturally, avoiding force and overextension of limb and joints. 9. Adjust stocking. Stocking should be wrinkle-free to the knee. 10. Place the call light or signaling device within reach of the patient. Ensure the bed is low and locked. 11. Perform hand hygiene.
CNA Skill 2 Short Dialogue.
2. Applies one knee-high compression stocking, Ted hose. CNA, Mr. Davis, the doctor ordered compression stockings to help improve your circulation. I'm going to put one on your left leg now. Let me explain what I'm doing as we go.
Patient. Will it be uncomfortable?
CNA, it should feel snug but not painful. I'll make sure it's smooth and wrinkle-free up to your knee. Please let me know if you feel any discomfort. CNA Skill 2 Extended Dialogue. 2. Applies one knee-high compression stocking, Ted hose. CNA Maria, Mr. Davis, your doctor has ordered compression stockings to help with circulation in your legs. I'm going to apply one to your left leg this morning. Mr. Davis, will it be uncomfortable? I've never worn these before. CNA Maria, it should feel snug but not painful. First, I need to position you lying flat and expose only the leg I'm working on for your privacy.
Mr. Davis. Okay, I'm lying flat now.
CNA Maria, perfect. I'm turning the stocking inside out to the heel, then placing it over your toes, foot, and heel. Now I'm gently pulling it up your leg, being careful not to use force.
Mr. Davis, that doesn't hurt at all.
CNA Maria, good. The most important part is making sure the stocking is wrinkle-free all the way to your knee. Wrinkles can cause pressure points and reduce effectiveness.
Nurse Supervisor. Maria, how did the stocking application go?
CNA Maria, very well. The stocking is properly positioned, wrinkle-free to the knee, and Mr. Davis reports no discomfort. Thank you for listening and studying with our podcast episode. Stay tuned for more episodes coming soon your way.